In every 100 mothers who visit our facilities to deliver, 28 of them are teen mothers.
Wakatupeleka sijui kwa pub, tukakunywa. Hapo ndipo I get my pregnancy.
I took part only one term. Then I realized that I'm pregnant while 6 months.
When you look at sexual violence, we stand at 16% against 13% at the national level. A number of them are children.
This is 17-year-old Esther Wanjiru, not her real name. She's a Form 3 student at Ronyange Secondary School, just weeks away from giving birth. But this isn't the motherhood story she dreamed of. Her plans of finishing school and becoming a nurse hit a wall when desperation led to a night that changed everything.
Nilikuwa napata school fees. Nilikuwa natumwa nyumbani nakaa for about 1 month. Nikirudi shule nakuta wengine wamesoma, inakaa sita wa captures. Saa inabidi tu nikae nyumbani, mamangu hapati pesa, hakuna kazi yenye anafanya. Babangu mwenyewe hana kazi, kazi yake ni huko anaenda kupiga mawe. Akipata 100 anakuja ananunua unga ya tunapika chakula. Inakuwa ndio chakula nditoshi. Unaona? Sasa tukienda kuna time nafika naenda shule sijakula. Sisi kashamba ketu ni kandogo, hadi tukilima. Hatuwezi pata chakula ya kutushibisha tumbo na ya kunilipia school fees. Sasa nilitumwa tantami form 2, mimi sikusoma. Nilitumwa nyumbani nikakaa kwenda wamefanya mitihani, mimi sikufanya mitihani. Najua na nikakuwa stressed. Nikaona kama ni wazazi wangu hawanilipii.
When you are 17 and desperate, when you've missed an entire third term because there is no money, what do? For Esther, her elder cousin had a suggestion, a party hosted by some young men. What seemed like harmless fun became a turning point that transformed her struggle for education into something much more painful.
Kuna vijana walikuja wakatuchukua, mimi hadi siwajui. My cousin alikuwa anajua, but unajua pia alikuwa tu hivyo. Tukaenda wakatupeleka sijui kwa pub. Unaona? Wakakunywa, tukakunywa. Hapo ndipo I get my pregnancy. Hadi sijui baba mtoto mimi nilijikuta tu am pregnancy. Siku hadi nataka mamangu ajue kama niko pregnancy. Nilikuwa naenda shule tulipofungua first term kuingia form 3. Mimi sikuwa nataka mamangu ajue kama niko pregnancy, ni akue stressed. Juu hadi ukiangalia hako katoto ako nako kandogo aliachwa na brother yangu. Bibi ya brother yangu alikufa, akamwachia watoto wake. Mamangu ndiye anajua chenye wanakuwa. Sasa ukiangalia kuna challenges. Nikaona akikuwa stressed anaweza tuacha bure. Sasa mimi inabidi tu nitavumilia, nikienda nafukuzwa. Nikikuja tu najifichanisha narudi shule. But the time walimu walijua sijalipa hadi kitu. Unajua nilitumwa kabisa. Ikakuwa nikaambiwa nisingie kwa gate.
One night, one drink too many. Her life changed forever. But her story isn't unique. Just meters from her home in Kagiju village in Imenti North lives 16-year-old Mercy Anyango, also not her real name. She's 4 months pregnant and facing an eerily similar reality.
Kilifanya hapa niwe hivi. Nilikuwa nafukuza shule for many times. Nikakosa feels, nakuja nyumbani. Nakaa nyumbani almost 2 months bila kurudi shule. Nikirudi shule, nafukuza tena, narudi home tena. Naita wakati wa exam, nafanya exam na wengine. So hapa venye tu nilikuja home, hapa kwenda kurudi home, kwenda shule nikirudi home ndivyo nilipata niko na ball. Nilikuwa na boyfriend. Huyo dude alikuwa ananisaidia na vitu vichache za shule, kama mafuta ananibaia, kama blow dry ananifanyia nywele. So for what, najua mtu saa hii tuko kulingana na Kenyan economy vile iko, kila kitu unachofanywa lazima utalipa. So I got myself nilikuwa na ball. Nilikuwa nakosa pants, sikuwa naenda shule. So nilikuwa naenda tu naeleza mwalimu vile situation ilikuwa. Just mwalimu anaelewa. Pia yeye ananisaidia, ananibaia tu.
Unlike Esther, Mercy knows who got her pregnant, a fellow Form 4 student who had since denied responsibility. But like Esther, she admits she didn't understand the risk of unprotected sex.
Shule si bado tunasoma, alafu nasikia tu mwalimu akisema just if I want your periods, jo uko na bola ama uende hospitali kuna shinda fulani. So nilirealize, so my periods zilikuwa zinakuja accurately, dates zenye ziko sawa, zilikuwa zinaruka ama zipungue. So ilikuwa accurately. Kama ni 13 ni 13 exact. Hakuna kusema ni 14 ama 15. Hapana, ilikuwa 13 exact. So nikakosa 13, nikangoja that week kaisha, nikaona hakuna periods.
Keep quiet, start to measure.
Nikaanza kuumwa na tumbo. Nikaanza kusikia kuna kitu fulani nasikia kula. Nikikula nasikia bando. Hapana, kuna kitu kingine nahitaji. Natafutia kitu mali nitaitoa na kula. Kutapika, natapika asubuhi. Kulala nalala, naamka late. So that's nikarealize kuna ball. Nilikuwa kuanza clinic this week, but mpaka sijapata pesa. Niko na just chache sana za kuanza, na vile nasikia kuanza clinic kuna cost, so sijaanza bado. Nilikuwa kuanza this week, nikipata pesa mali nitatoa.
These aren't isolated cases. Meru County has long struggled with adolescent reproductive health. According to the 2022 Kenya Demographic and Health Survey, the county's teenage pregnancy rate stands at 24%, substantially higher than the national average of 15%. Even worse, only 61% of births occur in health facilities, and just 45% of pregnant women attend 4 or more antenatal care visits.
In Meru County, it's lack of knowledge. Lack of knowledge about their sexual and reproductive health rights, and also the peer pressure. Peer pressure about their peers, that if my friend is having a boyfriend, then I can also get one. And also due to peer pressure, when you look at the FGM in Meru County, it's a contributing factor to teenage pregnancy because when a female gets mutilated, they feel that they are adults. But of course they are small children, they are youths, but they feel that they are adults, and that's why they end up getting pregnancies.
In 2022, the Ministry of Health ranked Kenya third globally in teenage pregnancies. 1 in every 5 girls aged 15 to 19 was either pregnant or already a mother. In Meru County, the crisis runs even deeper. Between January and May 2023 alone, 3,998 out of 15,389 women seeking antenatal services were adolescents. That's 26%, the highest rate in the country. The trend has been worrying over the years, 27% in 2016 to 41% in 2017 and 45% in 2018. But the most alarmingly, during COVID-19 lockdowns in 2020, pregnancies among girls aged 10 to 14 nearly tripled, from 473 in 2019 to 1,341. Yes, you heard that right. Girls as young as 10 years old. While the number dropped to 1,113 in 2021, it still remains high. In 2022, 10,561 out of 34,808 pregnancies in Meru were among girls aged 10 to 19, nearly one-third of all cases. For many girls, pregnancy doesn't just end education, it can end family relationships too. Some face rejection, abuse, or are forced to flee their homes. But amid this crisis, safe havens exist. Institutions like Greenland Girls Mount Kenya Institute Rescue Center provide lifelines for pregnant teens and young mothers. Currently home to 90 girls who live on site with their babies while continuing education, it's both a school and a sanctuary. One resident is 16-year-old Jane Juma, not her real name, caring for her 9-month-old baby.
My father was unable to pay for me the school fees to join Form 1. And I was late to join Form 1. So suddenly, I met a boy who said that he would provide me with the shopping. So he told me unless I have a bet with him so that he can provide for me. So I was so desperate because I'm coming from a humble family whereby I'm left with my father only. So I decided to have a sleep with him so that I can find the shopping. So unfortunately, at the time I had a sleep with him, I got pregnant. She started insulting me and she said that the ball is not for him. So my dad, finally we got a bursary and I was taken to a day school. Wakati niliendanga nikajifungua mtoto and I came back home again. Venye nilirudi kijana akakataa mtoto kabisa na akasema mtoto si wake na akatorokanga akienda. Tukimpigia achukui simu, akipigwa I started insulting my dad na kusema mtoto kabisa si wake. So I stayed at home.
Jane's story is heartbreaking. Desperation for basic school supplies led to exploitation. When her friends urged her to terminate the pregnancy and warned that nurses would shame her, she almost avoided medical care entirely. But her experience at the hospital surprised her.
Venye nilifika hosi, I got a nurse mwenye alinitreat vizuri. He talked to me so well. He didn't harsh me ama kuniongelesha kurudi, aliniongelesha vizuri. Wakati nilifika kujifungua, nikajifungua vizuri, hakuna stress na hakuna kusumbuana. Nilikuwa naenda clinic, niliendanga zote na daktari mwenye nilipatana na yeye. Aliniadvise cause my friends there at school walikuwa wananiambia it's shameful to be at 16 years to kuwa na mimba. So they used to advise me nitoe mimba. But wakati niliendanga hosi, daktari mwenye nilipatana na yeye actually was good. Akani advise, akanipea hope, akaniambia nisitoe mtoto. I might be carrying the future of my life, so nisimtoe. I keep on the spirit, na wakati nilikuwa namwambia sina vitu zingine alikuwa ananisaidia.
Another resident, 16-year-old Susan Chepkoech, also not her real name, represents an even darker reality. She was brought to the shelter by the local chief after enduring repeated physical abuse from her mother.
Before I got pregnant, my mother disappeared after doing my KCP. So I was left alone without food, without anyone to guide me. So the life was hard, whereby I got a friend who supported me, like food only. Then I mess up with him, where that I got pregnant unknowingly. So the time I joined Form 1, I was already pregnant, but I didn't realize. So I got Form 1. I took part only one term. Then I realized that I'm pregnant while 6 months.
She didn't even know she was pregnant until 6 months in. With no options, she took on casual jobs to survive, working until her final month of pregnancy.
Then after birth, I had that retro full remain. I only take it until the time that I recover. Then I found for another kibarua. I was employed again with that baby. It was 2 months. Then I stayed for that kibarua for 3 months again. I told that mother that employed me that to pay my school fee. So she agreed. Then after 1 month, after I got to school, my mom said that she's not ready to take care of the baby again. So she started boring me, pushing me out of the house at night. And she always beat me. Then I went and I told our area chief.
Unlike Jane, Susan didn't receive youth-friendly services. Her experience reflects why 39% of teenage mothers still don't deliver in health facilities. Fear, stigma, and lack of support keep them away from crucial care. "20-year-old Emily Gaishugi shares another heartbreaking journey, balancing Form 4 studies while caring for her 2-year-old child battling meningitis.
Kitu yenye ilinikost kupata mtoto ni eti siku hata napata basic needs. My parents hawakuwa responsible. Sasa nakanga hata na dad, mother aliniacha tu. Sasa siku hata fees napata, lakini huyu baba mtoto wangu ni eti alikuwa anani provide like basic needs kama food na hizo vitu zingine, sababu like ladies tunahitajingi vitu mingi sana. Sasa ndo niliposhika ball akaniacha. Anti sahi hajai kuwa responsible na hajai hata tamani kutake care mtoto. Halafu mtoto wangu anakuanga anashinda, anakuanga na train milestones. Nampelekanga therapy every week. Na sahi hata simpelekangi sababu sometimes sipatangi pesa. Hapa shule ndo uanga na provide sometimes. Wakipata do wanani provide. Sasa hata naomba tu nipate mtu mwenye anaweza ni sponsor tu hata na hiyo pesa ya therapy. Kama babu huyo mtoto alikuwa tu hata amenipea ndo za kutoa. Ndo kitu yenye ilifanya by the to part ni eti nilikataa kutoa ball. Na hata time yenye nilikuwa nashika mimba siku hata najua mambo ya relationship hiyo sasa.
Once abandoned and weighed down by shame and stigma, these teenage mothers have found a second chance at life in this rescue center, a place where they receive education, care and empowerment to rebuild their futures.
Most of them, when they come here, they've really lost hope. But once they fit in, they see they are not being judged for that mistake that happened. You find they adapt, and it brings also a change also to the livelihood of their kids. One of the most, I can say, traumatizing case that we have here is a case of a 16-year-old girl that was brought in here when she was 15 years. She was sodomized by the father, the biological father, and the paternal uncle, the brother to the father, that we are trying day in, day out to ensure counseling is being done. We also try to look for medical approach for her because she underwent fistula. So we're on the process of ensuring she gets the reconstruction done, and again counseling weekly so that whatever trauma she underwent, it can be able to be changed. What we are really trying to achieve is for these girls not to lose the motherly touch or the motherly bond with their kids. So they prepare their kids in the morning. Some of them go for preps, the Form 4s. They come back at 6, prepare the kids, give them the breakfast, the daily necessity. Then the kids are taken to the daycare. After the kids being taken to the daycare, the girls go for their classes. They will come back at 10, those that need to breastfeed their kids. They breastfeed, then they attend the other classes. They will come again during the lunch hour break. They have their lunch as they are feeding their kids.
Currently, we are at 28% according to the KHIS, that is Kenya Health Information System. It shows that we are at around 28%, meaning in every 100 mothers who visit our facilities to deliver, 28 of them are teen mothers or teenagers. Between 15 to 19 years. Another problem that we are facing, it is shortage of our healthcare providers. It cuts across from all the sub-counties and also at the county level. We have that shortage. And also we have limited knowledge and information, especially to our healthcare providers on adolescent and young people sexual reproductive health services. Why? Because we find that most of our healthcare providers were trained a long time ago, and so to be able to handle these young people the way we used to handle these young people previously, it is not the way we are handling them now. You know the problem of our Gen Z. They are very delicate. And so when they come in our facilities and find that the one who is offering the service is an old person, they shy off and they decide to run away from our facilities.
The crisis extends beyond pregnancy into violence and abuse. Meru County's sexual violence rate stands at 16% against the national 13%, and physical violence at 36% versus the national 34%. FGM rates also exceed national average at 19% compared to 14%.
And when you look at a higher percentage of these cases, a number of them are children who are violated, are children, and that's why we also have that contributing to the high cases of children coming to our maternities for ANC services and also to give birth. But when you also look at the issues of physical violence, Meru County, we stand at 36% against 34% at the national level. And that one makes me relate the issues that children go through, because if we have unworking homes, if we have broken homes, children are left exposed and the community will take advantage of them. So, and then another thing that is also an issue in Meru, when you look at the issues of FGM, which is also against human rights, which is a violation of human rights, Meru County we stand at 19%, against 15% at the national level. So it tells us that still Meru we are practicing FGM.
In response, multiple organizations, Reproductive Health Network Kenya, Ministry of Health, Mount Kenya Trust and Chase Africa launched comprehensive interventions. The goal, increase adolescent responsive services and create an enabling environment for young people to access non-judgmental care. The interventions are showing results. By July 2025, 81,552 adolescents and young people accessed youth-friendly sexual reproductive health services across 11 hospitals in 11 sub-counties. That's an increase of 9,480 adolescents seeking antenatal care in just 7 months of 2025, a massive shift in health-seeking behavior.
The number of things that were making youths shy away from the facilities, one of them was the attitude of the healthcare providers, because at times they could come for the services and then they could not get the services because maybe if they are the youths and they needed sexual and reproductive health services, healthcare provider could see that maybe they are not eligible for that services because they are underage. But after the training, of course, it has changed the attitude of the healthcare providers, and at the same time, it has had a good impact.
Over 45,000 adolescent girls and young women in 11 sub-counties in Meru County had accessed youth-friendly services. And really this was attributed to the work that we had done in Meru County, with healthcare providers, but also the community sensitization. We were able to continuously, using the community health promoters, conduct what we call the integrated community dialogues, where we were not only providing services, but we were having conversations with the young people, being able to break the taboos, the barriers that, hinder access to youth-friendly services, but also help them, get the information in terms of where they can access these services and the support they can get.
Training healthcare providers became crucial to changing attitudes and approaches.
When the RHNK came, they came at the right time, and they assisted us especially to train our healthcare providers, whereby we started with the TOTs, the trainers of trainers. There were about 20 of them across the county, and we trickled down, whereby we trained 60, the first bunch was 60 healthcare providers on the provision of adolescent and young people, SRH, that is sexual reproductive health services. And then we trickled down to our CHPs, whereby we sensitized them on AYP SRH, whereby they are able to whip our young people from the community and bring them in our facilities, because we realize that when these girls are pregnant, or when they become pregnant, they don't come to our facilities to seek services, and so they come at the when it is too late with a lot of complications.
We formed what is called County Technical Working Group that is involving all the stakeholders. It's involving the gender department, it's involving the social protection, it's involving the police, it's involving the county commissioner and the Ngao team, so that at least when we have a problem, we have come together to discuss. We also involve the Njorincheke people, we also involve the religious leaders, and through this taking a working group at the county level and also at sub-county levels, we have been able to keep reducing, and also the Department of Education is also helping us. We have been able to keep reducing these cases.
So the materials that you're using...
Community engagement became equally important.
We've been doing community dialogues, a lot of awareness on it is really important to have these youth and adolescents empowered, and if they need to access the services, for example, if it's needed a consent by the parents, then the parents should be able to support these girls and boys to get the services from the facility. I am happy to say that we've seen some good report from the facility. As we are doing the visit, we've now seen a lot of teenagers are able to come to the facility to even seek ANC services, which wasn't happening before. We are getting cases of a girl has gotten pregnant, she wasn't coming out of the house because of the fear of stigma, fear to be judged. They don't go to the facility because they fear that they'll be judged, but now that they're coming to a facility and meeting someone who has been given the training, they are able to seek the services.
Sasa nimejua about the community na nimeshaingiana nao, na tuseme challenges ni mingi kwa saa hii kwa youth, kwa sababu naona wameingilia maneno ya drug, early pregnancy, maneno mingi. So ile challenge iko, tukienda kwa community unakuta watoto underage wamepata watoto, vijana, drugs, alafu community zingine unakuta sister hadi brother wamekuwa afraid. Na lakini waga tunajaribu sana kwa church. Kama ni church, tunaenda tunaita youth. Tunapewa siku yao, tunawasomesha vile wanaweza jikinga na early pregnancy.
Despite progress, challenges remain. 39% of girls still deliver outside health facilities, though 93% of youth report improved service quality, showing interventions are working. Family planning services saw drastic increases. 10 to 14 age group rose by over 50%. 15 to 19 group jumped sevenfold from 530 to 3,934 clients. And 20 to 24 group soared from 1,619 to 11,279. But alongside this progress, health officials flagged a troubling trend: rising HIV infections among girls aged 10 to 14 and young men aged 20 to 24.
The number of youths that are outside there, we encourage them to come for the services, noting that the youths have special needs. There are things that they may be having and they cannot be able to express themselves. For example, when we look at the reproductive health of the youths, they have issues that they are not able to share with others, like the handouts. Number of youths are having even the sexually transmitted infections, and they cannot be able to share because of the barriers that were there before. At the same time, the HIV, of course, we encourage them to come for the testing, because when we look at the HIV analysis for the youths, it's going higher because they are not able to come for the testing and also bring their partners for the testing.
The emerging pattern reveals dangerous misconceptions about risk.
A number of the young girls, they are not afraid of HIV. They are only afraid of pregnancy. So they are misusing the methods of family planning, like P2. They are really misusing P2. But when you look at the guideline, it is saying P2 is supposed to be used once in a year. And it's for emergency. Even me as a married woman, I cannot keep on using P2, no. But our children are swallowing it like premende. But now, also our policies are telling us that don't discuss the issues of family planning with the children. But why are we cheating ourselves as a country? We already know our children are sexually active. We need to teach them on, one, the effect of misusing these methods. Si ati hawajui, wanajua. But as a country, we are so blind that no, our children doesn't need to know this. They already know, and they are misusing. So maybe it's a recommendation that even the government needs to rethink on what can we do. Because moving forward, the infertility rate will be very high.
Poverty remains the primary driver of this crisis. While some areas of Meru County thrive economically, many families struggle, leaving young girls vulnerable to exploitation and early motherhood.
Besides the training, we found that another thing that was leading to teenage pregnancy was lack of access to sanitary pads. So as we are talking to our girls, we are saying, actually, it's not that I wanted to get pregnant, but because I wasn't able to access sanitary pads, this border person or this guy took advantage of me after they offered me the sanitary products, and the only way I would pay was through transactional sex. So we came down and thought of now the usable pad after giving them the disposable pads for quite some time, and that wasn't sustainable in the long run because we depend on donors. So one donor supported us, and we were able to train a group of women, 20 women, on how to make the usable pads. So they did the first bunch of our first 5 at the dignity pack. We call them dignity packs because we're talking to them about their dignity. We want to make menstruation as part of life. Should it be you shouldn't feel hard when you're on your period. You should not miss school because you're on a period.
Most of these dropouts also the boys. You realize that if you move around your sub-counties and areas where there's high teenage pregnancy, you realize that the ratio of boys to girls in school is very alarming. There are a lot of boys who are not in school. So once these boys go to Bonda, and they're the ones who are carrying the girls who are left in school, they end up again impregnating these girls.
After her mother discovered her pregnancy, Esther's story took an unexpected turn toward hope. Instead of rejection, she found support. Together, they sought medical care.
Tukaenda clinic, I attended hii Lwanyange dispensary, nikaenda nikakuta wana hizo vipimi, wakanituma Kadhithi dispensary. Kuenda Kadhithi dispensary kuna kipimia wakuwa nacho, wakani referred to general. Juu hatukuwa na hizo pesa za kuenda hiyo fare ya kuenda general. Unajua tulijitahidi tukainama huko Giaki. Huko ndipo nili attend my clinics, but they treated me well. Mi sahi nikaa sina difference juu andi wenye nilikuwa naidanisha na wao sahi wamenitenga. I'm alone, but in my family tuko tu vizuri even though we faced challenges.
Now nearing her due date with only one clinic visit remaining, a visit that could coincide with her delivery, Esther hasn't given up on her dreams.
Mi nikipata mtoto, naweza tu achia my mom, naendelea tu na shule. Juu, hii haikuwa my plan. Plan yangu ilikuwa tu nimalize shule, nipate grade nzuri, niendelee tu na masomo yangu.
Teenage pregnancies in Meru County are not merely numbers on a chart. They represent thousands of young lives disrupted and whose futures have been compromised and dreams shattered. It is also a matter that signals a persistent cycle of child sexual abuse that goes unaddressed. Despite interventions, it is clear that much more needs to be done. Margaret Kimathi, NTV in Meru County.